One of the regular highlights from my time as chair of Barts over the last 4 years or so have been the chairman's lunches, because they give me a great opportunity to meet many of you who've been nominated by your colleagues, by our patients, by our business partners, for everything that you've achieved in line with our We Care values. Now, for obvious reasons, the chairman's lunches have needed to go virtual now. And what I'm therefore going to do is read out just a few of the many nominations, starting with Roy Singh. I feel really lucky and grateful to have Roy as my regular driver. He knows my health and looks after me very well, and he gives me motivation to carry on with the treatment when I feel down and did not want to carry on. Mohammed Uddin has genuinely inspired others to become more involved in the community by reaching out to those who are not as privileged to make a positive change in their health and personal well-being. He amplifies the true value of the NHS and is a credit to his team and the broader services. Peter is our lifesaviour in theatre, especially on call during emergencies. He is caring to all the patients. He is punctual, hard-working, and goes above and beyond his duties to help with cases. I felt compelled to write and thank you for the very kind way in which you both dealt with and spoke to myself and my husband when my dad passed away. I was utterly distraught. To know that such a very kind and lovely man as you was with him in his final moments has helped ease that part of my pain, and I truly appreciate it. I was on Ward 13F for nearly 2 months. All the staff, doctors, nurses, cleaners, food and beverage staff told me I would make it, and I did, because of them. I would like to see their faces if they saw me now and give them a huge hug. Finding out on a sunny morning that I had ovarian cancer was surreal and profoundly shocking. I don't remember what Deborah said. All I remember is that she made it, somehow, okay. It wasn't sympathy, pity, or hollow positivity. It wasn't from a training session. Her kindness that morning was a Zimmer frame of solid gold, and I leaned on it all the way home. I am nominating David for an award, as he deserves recognition for the work that he does. I work as a midwife on night duty, and when he arrives in the morning, always greets the staff with a smile, despite knowing we have a long list of jobs for him to do. I was diagnosed with testicular cancer 2 months before the birth of my first child. It was a scary, anxious time. Michelle and Shiv were with me every step of the way. This hospital has always been very special to me. A family hospital that gives care and attention that is out of this world. Thank you for caring for me during my heart surgery. In the short time that Shanthini has been at Whipps Cross, she has completely changed our language for death and dying. She has been proactive in engaging staff to have open and honest discussions about this topic. Stratford Ward, you are our health heroes. You are our NHS heroes. At the end of a storm, there is always a rainbow. Thank you for taking care of our rainbow in stormy times.
I need to help somebody, If somebody needs my help, I'll try my best to give that help.
I'm the guy that stays the hours extra when it needs to, or help out where I need to. So if there's a need, I'm there.
It is my duty, and I'm passionate about caring for people.
It's in my nature, I don't know.
I think it's part of me, it's a passion.
You've got to love your job. You've got to be interested in what you're doing.
They always call me Mr. Help Me. I spring to action. I don't waste time.
It's your passion that you have to do this job, so you have to give the passion to the patient.
Our patients are at the heart of everything we do. We carry them along.
Drop off and pick up, that's what transport used to be about. But since we've put We Care on the uniform, We Care has to start from in a house. You've got to make it work, for the patients.
As a healthcare support worker within surgery, you can do things that will have an impact on everybody, and you can help the service. We are the patient's representative, because at the end of the day, we're here to keep their dignity and make sure that they are looked after.
patients come out of the room, they've just been told by the doctor that that they might have a cancer. Sometimes they don't want to talk, sometimes they do want to talk.
Through our work with the testicular cancer patients, we kind of realised that actually, you know, a year or 2 years down the line past their diagnosis, sometimes that's when people need the most support.
We're very proud of the support group that we're running. We didn't know if anybody was going to come. Our last check, we had 201 patients in that group.
We serve a community which has a lot of people who come from different backgrounds.
Not everybody is privileged. Not everybody have money to buy a good food, quality food.
I just took that as a challenge and I started raising awareness on end-of-life care. You have to make sure that you know the person, not just by name or diagnosis, but know the person. Would he like to be in his own clothes? Would he like music? Would he like to see pictures of his family? What is it? It's being mindful of that.
Education is not about telling people off. It's about listening to them. Diabetes is the patient themselves. They can make the changes. We can prompt and support them. So listening to them and understanding them, we can achieve greater.
Knowing these values are there and it's something that you can strive towards.
We can only do this if we all work as a team.
The teamwork, we understand each other.
Your problems are not your own. Everyone is there to help if you need them.
We need to keep up with the high standard of care and just keep working together as a team.
We deal with someone's mum, someone's dad, someone's brother, sister, daughter every day in extremis. It could have been my third dad that week, frankly, but that poor daughter's only going to lose her dad once. And the memory of that experience will be part of her life forever. And how we treat her is critical because it's a small interaction for me, but she'll never forget the day her dad died. Never.
Even with the PPE and the awful sights and the awful times, it was still like giving a gloved hand to a relative or giving a gloved hand to a patient or, you know, calling relatives and saying that I'm sorry you can't be here, but we're here and that's what we're here for.
Getting to know that we are nominated is a motivation to what we do, that sometimes you don't know how much these patients appreciate what you do for them.
It's nice to know that what you're doing is actually worthwhile and actually means something to the patients that you're looking after.
Just to be able to get some recognition for all we've put in with all the blood, sweat and tears, literally, it just means a lot. Yeah.
So I'm so happy for this kind of nomination, for people to have recognized your efforts.
I have to be proud of myself because I'm part of the team that we become the hero.
And I feel proud.
Oh, it really boosts our morale as well.
It's a great thing, great feeling.
Thank you.